Hey, I want to welcome you back to the Weight Loss Decoded GLP Edition podcast. I am your host, Sharon Polsky, the GLP Fact Fairy. And on today's episode, we are going to be speaking to Dr. Lester Lee, and we are going to be talking about the myths of GLPs and debunking some of the information that has gotten out there on the internet. And Dr. Lester Lee is one of the founding fathers of functional medicine. So I'm super excited to share this with you. Stay tuned. Dr. Lee, tell us a little bit about your background and your association with GLP-1.
Thank you, and hello, Sharon. My name is Lester Lee. I'm a physician in Huntington Beach, California, and my background is training in internal medicine, University of California, subspecialized sports medicine by fellowship training in sports medicine. I'm a past 88-92 Olympic team physician for track and field to Korea and Barcelona. And my interest in functional integrative is the major emphasis. And weight loss is part of it. Hormone replacement therapies, thyroid function, adrenal functions, gut functions. Again, the whole body approach, which we call functional integrative medicine. But today's topic, we're talking about weight loss, and as Sharon mentioned, the major boom interest for the past couple years has been the GLPs, glucagon-like peptides. Peptides are amino acids linked together, and medications such as Ozempic, Wegovy, Mounjaro, those are peptides that have the effect, of weight loss in general. But Sharon has some specific questions that she wanted me to address, so I'm going to let her take the lead.
Yeah, so we are going to talk about the top 10 questions that I am consistently asked, but I am going to share an interesting story with you, Dr. Lee. I scanned a client today, and she's on GLP-1. She takes semaglutide. She's at like a moderate level, and she appeared to have not lost any weight in the last 30 days. And I put her on the BIA scanner, and she gained a pound of muscle and lost a pound of visceral body fat. And so that's why we're having this conversation, because there's so much misinformation out there. I'm very lucky because I get to see this in a real setting with real patients, and I get to use technology like BIA scanning so I can monitor their progress and see if they are losing visceral body fat and gaining muscle and talk about these things. But the majority of people out there that are interested in GLP-1s don't have access to me or to you. And so that's why we are going to talk about this today.
Super.
Yeah. So the first question I get asked is, don't GLP-1s make you violently ill? And in my anecdotal experience, if I have them eating regularly and make sure I give them protein and fiber, I have very few stomach issues. What is your take on GLP-1s make you violently ill?
Well, violently ill, if that's a side effect, the major side effects, 25-30% of people initially starting the GLPs, whether it be Mounjaro or Ozempic, Wegovy, Zepbound, is nausea, not necessarily vomiting, but queasiness, nausea, abdominal cramps, even constipation. If we utilize something like Mounjaro, tirzepatide by generic name, it works by dual mechanism of action. One, it stimulates the pancreas to produce more insulin, makes you more insulin sensitive to metabolize sugars, metabolism, calories come down, weight comes down. Two, it also has what they call gastrointestinal peptide stimulator, GIP. What that does is it decreases the absorption of the foods, of the carbohydrates that you're ingesting. So the benefits of having Mounjaro versus Ozempic is dual mechanism of action. The science has shown for the past 2 years, there's probably 6 to 8% over 6 to 12 months additional weight loss with Mounjaro family compared to the Ozempic semaglutides.
So now, the tirzepatide side versus semaglutide, the tirzepatide side, we are seeing less side effects and more weight loss.
Yeah. And the effect of nausea comes from, for example, the Mounjaro tirzepatide is the gastrointestinal peptide portion that decreases peristalsis, contractions of the stomach, which can cause the cramps. which can cause the nausea. So unfortunately, I would say a good 25, if not higher percent of people initially, which normally they will adapt to. For that reason, the majority of people, let's say right now in the United States, who are utilizing the GLPs, not because they're diabetic, that's the indications for diabetes, but for weight loss. So the idea, of course, here is not to intentionally make you more nauseated and cramp and get diarrhea or constipation. Therefore, you lose weight because you don't feel like
Yeah,
eating.
that's not what we're
Less
looking
calories
for.
going in, but
Yeah.
the mechanism isn't intended to be that way. Indirectly, some individuals develop this because of they may have an empty stomach. They may be more prone to the not necessarily gastroparesis, which is another side effect we can talk about.
Yeah, I
Which,
have. That's actually question number 9.
okay, so they don't become violently ill
Yeah.
as much as the queasiness part.
And
If
for me with tirzepatide, it made me feel full. And that feeling of being full, I could see people being like, oh, I'm queasy. But for me, it would be the same in my head. Feeling of full or feeling queasy would be the same.
and it might be dose related also because tirzepatide Mounjaro comes 6 different strengths from 2.5 all the way to 15. Majority of people don't need the 15.
Mm.
Somewhere between 7.5, 5, 7.5, 10 tops is more maintenance after 6, 7, 8 months. So violently ill, the only time I saw it one time was another surgeon who inadvertently, I should say not inadvertently, but do proper testing and prescribed the GLP to a patient. After one injection, developed pancreatitis, ended up in the hospital, violently ill. So pancreatitis, you can feel violently ill, but a little queasy, nauseous, we don't consider that violently
No.
ill.
And question number 2 is it makes people so sick they are regularly hospitalized. It's funny because the questions are so extreme. These statements are so extreme. But in my case, I have over 2,000 patients now through the telemedicine platforms I work with that are on GLP-1s, and none have ever been hospitalized from a GLP-1. I don't know where that is coming from. What's your experience with that?
Well, there are multi-millions of Americans on the GLPs now. Very few incidences requiring hospitalization, back to your question. But in our own practice here, we have not thousands, but hundreds of patients that we may have started over the past few years for whatever period of time, and not one required hospitalization. There are, again, 25, 35% of individuals who said, I feel a little queasy, but you know what? By the second, third shot, I got over it. Or there are other 75, 80%, didn't bother me. My appetite went down. I feel a little bit tired, but that's all.
Yeah, that's what I
Didn't
get a
bother
lot
me.
tired.
But because I lost my appetite somewhat, that's just maybe a secondary benefit because I'm not having more carbs in here, therefore less calories, and I'm losing weight too.
Yeah,
So,
that's exactly what I saw. Question number 3. You lose body weight, but not body fat, and it's mostly muscle.
well, back to the question you had mentioned about the patient that had gained weight, gained a pound plus of, and lost body fat, visceral fat. So there is reported that you get muscle wasting, muscle atrophy called sarcopenia when you get on these GLPs. Okay. I've seen that in my own patients. However, it's because they don't work out, especially resistance training, and their caloric intake sometimes is significantly decreased because of the appetite suppression and because they are changing their lifestyle. They don't get adequate protein in the diet. And muscle is made from amino acids into protein, proteins into tissue, into muscle. So when these individuals are on these GLPs, always let them know you gotta work out, maintain muscle mass. Otherwise, you're going to look like Ozempic face. And you're going to
And
have skin
Ozempic butt.
on your bones. So if you do resistance exercise like personal trainers like yourself, Sharon, who have a lot of experience in those various areas of metabolic medicine, physiology, kinesiology, we work with those individuals to help them gain lean mass while they're stripping down sub-Q visceral fat. So
And you're also a doctor that's worked with a lot of bodybuilders. So you've seen, I mean, that's like the holy grail of bodybuilding, right? Is drop them to very, very low levels of body fat while they maintain muscle, but they even drop muscle when they're getting ready to step on stage.
sure, sure. And that's somewhat intentional with the figure fitness male female competitors because during off season, they're trying to get more bulk density. But as they approach the last 10, 12 weeks of getting on the stage, they're trying to review the work product, the cuts, the separations, the densities, the tone. So they're going to carbo deplete intentionally
Yeah.
because that makes you hold on to water and makes you more puffy.
Yeah.
So it's a
Yeah.
different
So it's so
control, of
interesting. Like
course.
there's such a parallel between what we do with our fitness and bodybuilding competitors and our GLP-1s on this side. It's pretty fascinating.
Yeah, yeah.
So another question. Do patients have to wean off of their GLP-1s? Why? Just like if somebody is truly insulin resistant, and we wouldn't take people off of blood pressure medication, we wouldn't take people off of their cholesterol medication. Why do we have to wean them off of their GLP-1s?
You don't necessarily have to wean off, Sharon. I don't believe we've had any patients, let's say, when they reach the desired goal weight, they didn't really wean off. They self-titrate to as I need. So
Maintenance.
what they've done was whatever the dosage is that works for them, maintenance, somewhere between 5, 7.5. But they don't do it weekly, as the regimen is when you're trying to lose weight. They have said, you know what? I didn't go for about a month, but I started getting my appetite back. When my appetite came back, I started gaining a little more weight. Well, the majority of these people is because they haven't changed their lifestyle regimen of, let's say, diet and exercise, especially
Yep.
the exercise component. So they relied on the weight loss just strictly from the GLP and not because of strength conditioning, cardiovascular training. Um, so what they do is, well, instead of doing weekly, I just do it every 3 weeks, and then it keeps my weight down. I don't gain weight, and I only start up another quote unquote injection cycle if I feel
Yeah.
so.
So they're
They
not using
still
the medication
titrate.
as an opportunity to change the lifestyle in the beginning. So that's what's causing some of it.
Yeah. And there's no withdrawal effect when you stop like certain medications, whether it be blood pressure or especially antidepressants, anti-anxiety medications like the Prozac, Paxil, Zoloft type family. That's a little bit different mechanism, of course, too.
Yeah.
So in answer to the question, I've never seen anybody have problems. I just stopped for 2 or 3 months because I reached my desired goal. But in my fourth, fifth month, I think, well, we went to Europe, we went on a traveling, we went on a cruise.
Yeah.
Well, duh. If you don't eat on a cruise, you're wasting your money. So why go
Yeah.
on a cruise? You got to
Yeah.
have the 7 meals a day and get your money's worth.
Yeah. You have to.
Unless you're
There's
going
no
to gain
other
some.
way.
So what they do sometimes, they carry their pens with them on the cruise. You're spending all that money for a cruise, getting 6, 7 meals a day, but you're trying to suppress your appetite. Hey, I don't go there. I let them decide that.
I let them be as well. Do you have some patients that have weaned completely off their GLP-1s after they hit their desired weight?
A fair number of patients, they hit their goal weight, and they've also changed their activities of daily living, their lifestyle. They're working out more religiously, more consistently, and they're also watching the calories in, calories out, especially the part carbs. So we don't get overweight fat from eating fat. We get fat from eating too much carbs.
Yeah.
So the idea, of course, is when you do a lot of cardiovascular, you run a marathon, you burn sugar, your first form of energy. Well, if you don't have enough sugar around, then you go into your liver stores called glycogen, which is store a form of sugar called triglycerides. That's how the GLPs work, is to help mobilize those stores and burn of those stores, even though you're not necessarily working out.
Yeah. So, and I know you use compounded hormones, bioidentical hormone replacement therapy. You use a compounding pharmacy. What is your take on the semaglutide tirzepatide compounded, available compounded GLP-1s?
Well, the difficulty is sometimes finding a reliable pharmacy to make the equivalent consistent strength dosage of the semaglutide tirzepatide. the Ozempic Mounjaro.
Correct.
So, and sometimes the FDA gets involved telling them, hey, there's adequate supply of Ozempic and Mounjaro, therefore you compounding pharmacies cannot compound. It's just weird laws that we have to deal with
Yeah.
sometimes. But from a good, reliable pharmacy, like some of the ones that yourself, Sharon, works with, we've seen good results, equivalent results as if they're branded. But the
Yeah,
costs are
that's
much
what I've seen
less.
from the compounded. I mean, we're in California, so the pharmacies are very strictly regulated that are allowed to ship into California. I've seen exactly the same results from the name brand to the compounded.
Yeah. So if you utilize a well-respected, reliable pharmacy board, FDA, okay, good manufacturing principles, and all those legal terminologies, they work just as well. But you probably pay a one-third, one-fourth the price as
Yeah.
if they're branded. The branded stuff for 4 weeks, gosh, it's anywhere from 1,100 to 1,400. I've seen a wide range depending on which pharmacy, which state they obtain it from. Or sometimes if it's back order, you can't find them. That's
Yeah.
when we go towards the compounded version. Yeah.
Okay, so the last four are all related, and I call them the big uglies. We're hearing it in the media: pancreatitis, acute kidney injury, gastroparesis, medullary thyroid cancer, and they're constantly talking about these four in terms of GLP-1s and why people should never take a GLP-1.
Well, let's start with the heavier one, the thyroid cancer, the medullary thyroid carcinoma. Thyroid cancer, again, it has not been shown in any patient population, but in rodents during the investigations before the launch of the medications, there were some rodents who developed thyroid cancer. Is it because of the GLPs? But because it was in during the investigational phase before launch of the medication, it's a black box warning. So if you have a family history of especially medullary, it's a kind of thyroid cancer,
Yeah.
um, or you've had a history of thyroid cancer, it's a contraindication. Two, if you get pancreatitis, again, not common, but it occurs. I've seen one patient, not one of our patients, but some other doctor's patient. And again, pancreas produce insulin, they produce glucagon. The mechanism of action via the pancreas is how these GLPs work. So if for some reason it's overstimulated your pancreas, or maybe because you drink too much alcohol, or
Oh,
maybe
that's what I was just going to ask you about, was alcohol in GLP-1.
people who are heavy users of alcohol, let's say, whatever you define heavy usage as, or people who are not stable. We call it brittle. They're not stable diabetics, and their sugar's all over the board, usually really high. They're a little more prone statistically to develop itis of the pancreas, pancreatitis. And then you feel like you're going to die. That's when it ends up, like you said, makes you violently ill. Well, you end up in the hospital and they do blood tests. You're not just the liver, but your pancreatic enzymes are elevated. That's how they make the diagnosis. So not common, but yes, it's in the side effects profile. Uh, Individuals with kidney problems. Usually the kidney problems arise because you have pre-existing problems, you're diabetic, you have hypertension, you have some autoimmune disorder affecting your kidneys, but a lot of times your kidneys, or you have kidney stones. But if you are on a diet and you forget to eat, you don't drink enough fluid, you're dehydrated, you're more prone to kidney problems. And the more common kidney problems, what they call pre-renal, which means that you set yourself up for a kidney problem because you're dehydrated. Well, keep in mind, it does suppress our appetite. We don't feel like eating, but you got to drink a lot of water.
Yeah,
Or,
that's what I found too.
or you take a lot of NSAIDs, ibuprofen, Tylenol. How are they metabolized? They're metabolized by the kidney and liver. So if you're attacking your kidney working on overtime, you're dehydrated, and then you also are injecting these GLPs, you kind of potentially set yourself up for a kidney problem.
Yeah,
So,
it's what I've noticed. I've only had one client with a kidney issue. They were a bad water drinker prior, and then the GLP-1s make them a little dry. And we see a massive, even on the BIA scans, we see a really big total body water and intracellular fluid, extracellular fluid shift in
yep.
those first 30 days because it is so anti-inflammatory and neuro-anti-inflammatory. So we start to see an ICF, ECF shift, and then people are not drinking nearly enough water to live on, regardless if they were taking the GLP-1s. And that's when I've seen it only in one, and we caught it really, really quickly.
Yeah. It's important to be well hydrated and not take a ton of pain medications, the non-steroidal anti-inflammatory agents like the ibuprofens and the related and Advils, that kind of thing.
Yeah.
Uh, Again, if you're in pain, you need to take pain medication, work with your practitioner about monitoring those kidney enzymes because we don't want to put you in a kidney insufficiency. You really don't go into kidney failure. That's pretty extreme because
Yeah.
pre-existingly you
Extreme.
have some kidney problems even prior to starting. The other, let's see, kidneys, liver, cholecystitis, gallbladder attack. Again, it's been reported, it's in a package insert. I haven't seen it, but again, it has a lot to do with your diet. If you've had sluggish bile activity, if you have gallstones, you're on oral contraceptive, predisposes you to, let's say, gallbladder issues. Not very common, but it's in the package insert. Suicidal ideation. Again, some reports came out about individuals on GLPs, they're more likely to be suicidal. Now,
And that's exactly the opposite of my anecdotal experience of my clients. My clients felt more balanced on tirzepatide, not as many mood swings, their sleep vastly improved. But again, mine's anecdotal. So all I can do is share my experiences with my clients and then come to experts like you to talk about it.
well, the latest paper I just reviewed, I believe is one of our peer-reviewed journals, New England Journal of Medicine or Annals of Medicine, one of the medical journals, but they debunked that there was no increased incidence on this cohort study. Those individuals, if they had suicidal ideations, it's because they had a pre-existing psychological problem, major depressive disorder problem going into. So it's not cause and effect relationship. There's an association, but there's not cause and effect. There's a difference. So if you start a GLP, you're going to take your life out. Well, no,
Got it.
they kind of debunked that. It's a well-written study too. I just reviewed it actually yesterday because it just came out.
Yeah, I'll pull it up. I want to read it because I do get that one quite frequently from people. And then the last one is, and this is all over the internet all this week, and I don't know what triggered it, but gastroparesis. You're going to paralyze your stomach. And they say it just like that. It's crazy.
You know, it's in a package insert. I've never seen it. Again, if you're an individual, especially diabetic out of control, or you're insulin dependent diabetic, you're more prone to gastroparesis. Basically, it's paralysis, decreased motility of the stomach, and that's what gives you the cramps, the bloating, because it's not moving stuff around southward, so it builds up. So gastroparesis, yes, it's a potential. Usually, if we see that, it's in somebody who has a potential to have that in the past history. So again, your provider reviews, are you a candidate for it? Are you not a candidate for it? Maybe it's dose related. Again, I don't see that in our practice.
No.
Myself and my practitioner's office, we screen our patients quite well. And not everybody is a candidate just because I need to lose 3 pounds. Can I go ahead and go on one of those GLP, semaglutide, tirzepatide? I said, well, you know what? For that, save yourself the $1,300. Just use duct tape if all you want to lose is 3 or 4 pounds.
Yeah. Yeah, I find that all of these side effects that we're talking about, when I actually dig, so before we started the podcast, I started interviewing just GLP-1 patients, and the questions I asked people were side effects, and every single one of them said to me, if they were nauseous on GLP-1s, they say, well, I was always somebody that was pretty nauseous anyway, long before this. Or I was always somebody that had constipation before I started my GLP-1s. Or I was somebody that was prone to diarrhea before I ever started taking GLP-1. So I found it really interesting when I started talking to patients. And like I said, we have over 2,000 patients through our coaching system at Weight Care. And it is so rare somebody comes to me about these side effects. And then I just say, hey, how about you try eating an apple every day? And then they'll email me back a day later. They'll be like, it was a miracle. All I do is eat an apple and I feel great. I'm like, there you go. Like fiber, chewing on something, it's easy to get down. So I do find it really interesting how much the media has made of these side effects. And it's really they're just like you were saying, you very rarely see them in your practice. I very rarely see them with my clients.
They do occur. I don't know about the thyroid cancer part, but if somebody all of a sudden decided, oh my gosh, I had up the stomach, I had gastroparesis, again, that's one of the mechanism of actions of Mounjaro is to slow
Yeah.
the motility down, therefore decrease absorption of carbohydrates, less calories, et cetera, you lose weight. But if you set yourself up for that, you're predisposed to that, and we already know that you tell your provider, he's less likely to prescribe it, or he may go ahead and say, well, let's keep a really low dose, a baby dose, just to test it, just to make sure you don't.
Yeah.
But in terms of the other thing that you don't, other practitioners don't do that. We're pretty cautious in our office. I normally like to see a patient, I give them a prescription, get a thyroid ultrasound of the thyroid gland, just to make sure you're not going to have any symptoms, but just to make sure you don't have some kind of weird nodule growing there. Well, we don't want to make it more aggressive, just in case.
Yeah.
They say, well, I don't have a thyroid problem. Why do I need a thyroid ultrasound? Well, that's how we explain to them, thyroid cancer, I know it doesn't run your family, but we're going to err on the side of your safety. It takes all 5 minutes using ultrasound. There's no radiation. And interestingly, Sharon, over the past couple of years, we picked up 2 thyroid cancers via being cautious, not because they were on one of the GLPs. So that has to be taken care of. And guess what? They probably aren't a candidate. But
it's also a holistic approach to medicine. Like we should be treating the whole patient.
So in that regards, thyroid, and then of course we ask them about your history of pancreatitis, and otherwise that's just kind of a anecdotal story that, again, we're more proactive about the patient's health, not just you want to lose weight, but we want to make sure you don't kill yourself while you're losing weight.
Yeah.
Bunch of good outcomes, and we want the end results to last longer. Part of that has to do with the lifestyle, activity, daily living. You know about that, Sharon, because that's what
it's my love language.
So again, our patients tend not to relapse. They maintain, go a little bit up, but they realize it. So they don't necessarily say, you know what, I don't need another prescription of, I just go ahead, I know it, I cut the alcohol, the extra glass of wine at dinner. I don't take the extra donut or whatever it is. So, or if I do, I just work out more. Great, healthy lifestyle, work out more.
Yeah.
Not just rely on medication to suppress your appetite.
If you had one word of advice for somebody considering taking GLP-1s, what would it be?
Oh, a provider who's going to provide it to you is going to be really comprehensive and proactive regarding your health. Not just that we want you to lose weight and then bye. I mean, we're trying to change your lifestyle too, because not only does it lend to decreased cardiovascular disease when you lose weight, diabetic and kidney problems and liver problems and fatty liver changes, but we're trying to not just help your health span, but the lifespan. So they go hand in hand. Not that you just want to live longer, but you want the quality of that life called health span to correlate with the longevity. Because we don't want to be in a nursing home when we're 115 and just doing that.
Yeah, it's my biggest fear.
So I can't say specifically, Sharon, is there something I recommend somebody going on?
But you just want people to take a more holistic approach. Find a doctor that wants to take a more holistic approach to their weight loss so it's sustainable and helps them with the lifestyle intervention piece.
Don't rely on a medication pharmacologically for help you lose weight, because when you go off the medication, you're going to yo-yo. So that's
just a tool in your tool. GLP-1s are a tool inside of your toolbox, but you got to look at your 5 factors of health, which is your sleep, your stress management, your hydration, your exercise, and your nutrition. You've got to look at it all.
All of the above. Yeah. I agree.
Awesome. Dr. Lee, thank you so much for taking the time to talk to me and have a conversation about this new era of weight management. I really appreciate you taking the time.
You're welcome. It was a pleasure. Thank you.
Thank you.
Bye.
I want to thank you for tuning in to the Weight Loss Decoded GLP Edition podcast. My name is Sharon Polsky, your GLP Fact Fairy. And if you liked today's episode, if you could please subscribe, like, and share with your friends, that would be great. I also want to remind you that these are just the opinions of myself and my guests, and should not be interpreted as medical advice. Until next time, ciao for now.